get started. So, hi everyone. It's so wonderful to see everyone joining us tonight. My name is Melinda St. Louis, and I direct Public Citizens Medicare for All campaign, and I'm thrilled to welcome you all to our first Medicare for All Resolutions Coalition webinar of 2021. I want to thank you all for being here with us tonight. Particularly because we're all trying to process these mind-boggling and for many of us traumatic times. We continue our focus on building our movement for Medicare for All to transform our healthcare system because we really have no other choice, do we? The disaster of our for-profit healthcare system combined with the failed leadership in managing the pandemic has led to new and seemingly unfathomable milestones. Just in the past 13 days of this year, 3 million Americans were infected with COVID. And in several of those days, of those 13 days, we lost more than 4,000 fellow Americans each day to the virus. And all of this is happening as we're unable to ignore the collective trauma and political fallout from the violent insurrection led by white supremacists that took place at the US Capitol just last week, where our champion in the House of Representatives, Representative Pramila Jayapal, was infected with COVID after having to shelter in place in a crowded, secure location with colleagues who refused to wear masks. And we're facing ongoing fear and threat of violence over the coming week as President-elect Joe Biden is sworn in on January 20th. But we also come together in hope as we marvel at the ingenuity and dedication of scientists who developed an effective vaccine in record time, and thus we can begin to see the light at the end of the tunnel of this pandemic that has interrupted our lives in so many ways. And we celebrate the historic organizing and mobilization among Black voters in Georgia who changed the entire political balance in Washington by electing Senators Warnock and Ossoff on January 5th, leading to a soon-to-be Democratic majority in the Senate. Both the terror and confusion and the hope of this moment inform the new political landscape that we're facing in 2021. And we'll be discussing the opportunities and challenges to champion Medicare for All in tonight's webinar, especially as we continue our focus to win local resolutions in cities, towns, and counties across the country. We have an exciting panel of national and local leaders who will share their perspectives and plans, including Representative Khanna from California, Board Supervisor Holly Hatcher from Dane County, Wisconsin, Amirah Woods from National Nurses United, Stephanie Nakajima from Healthcare Now, and local activist leaders in Texas, DC, California, and New Jersey. This is a webinar. Please join the conversation by putting your comments and questions in the chat or sending us an email at medicareforall@citizen.org. We'll do our best to answer your questions, and our panelists can answer questions in the chat, or we'll follow up with you afterwards. And if you haven't signed up your community on our map, please, or haven't been in direct touch with us for a while, please sign up at the link that Brittany will paste into the chat. So let's jump in. Is that you, Representative Khanna, on the phone?
Yes, can you hear me?
Yes, okay, we can hear you. So first, I'm honored to welcome Representative Khanna from California's 17th District, who has been an important champion of Medicare for All on Capitol Hill. We're so grateful that you've made the time to join us tonight, especially knowing just how traumatic and strange the past week has been for you and your colleagues in Congress. We know that the situation keeps shifting every day, but we'd love to hear how our Congressional Medicare for All champions are approaching this new political landscape with a narrow Democratic majority in the Senate and a Biden White House. And also, as you're the author of the state-based Universal Health Care Act, we'd also welcome any insights you have about efforts in California and other states that may be interim victories while we continue to work on the federal level for Medicare for All. So welcome, Representative Khanna.
Thank you. Thank you so much for having me, Melinda. Thank you to everyone at Public Citizen for your incredible advocacy and fight for Medicare for all. We're in a national health crisis. We're in a time where millions of people are losing their jobs, losing their health care, and it is unconscionable that we don't have health care for everyone. You would think in a crisis where people are having to deal with sickness in their family, when they're having to deal with testing, and when they don't have insurance, that the natural response would be for the government to say health care is a human right. Everyone should have health care in America. In a functioning democracy, a crisis of this proportion would lead to a response saying that we need to give every American the health care they deserve. Unfortunately, we have had a dysfunctional democracy. I am inspired too with the results of the activism in Georgia, particularly of the African American community, but so many progressive groups that helped us win there. And I know many people on this call were active in that election. I'm inspired by your activism in helping us defeat Donald Trump and hopefully put an end to that ugly chapter in American history. But now we must turn to the work of actually improving the structural inequalities that exist in our country. So what is the roadmap forward? First, we have to still insist that Medicare for all is the right answer. And that's not out of stubbornness, it's out of the facts. The reality is Medicare for all would save the most cost to our system. It would be good for small businesses and manufacturers who wouldn't have the burden of high premiums. It's the only system that can ensure that people are not going to be underinsured and get the care they need, and that those who are uninsured are going to get the care they need so that we don't have medical bankruptcies and so that we don't have unnecessary and avoidable deaths. In my district, we had a young girl a couple of years ago who passed away from a sinus infection because she didn't get the proper care given that she wasn't insured. So this is a real human rights issue, but it's also an economic issue. I do believe we need a vote on Medicare for all in the Congress. My view is we get that vote when the discussion takes place in Energy and Commerce on how we fix the ACA. And obviously the ACA needs fixes as well. The subsidies, particularly for families, is inadequate to cover an entire family, and the costs of premiums are too high. So as we look to fix the ACA, we have to make sure that we're at least getting a vote on Medicare for all in the House. We're at least getting a hearing on Medicare for all, and we're at least getting substantive amendments that move us towards a single-payer system, either by extending Medicare's coverage beyond 65 down to 60, which was in Biden's platform, and then from there going even further and pushing for any steps we can take to get to Medicare for all. So my view is that that is going to be a critical moment of advocacy when there is the discussion in the Congress with the Speaker about how do we fix the ACA. That is where we need to insist on Medicare for all, and the Progressive Caucus will be able to do that. Separate from that, in the spring, we plan to introduce again my bill that many of you worked on and supported and the National Nurses did, that would allow states to implement single-payer systems. I know you're aware that of the example that people cite in Saskatchewan and Canada. They had a single-payer system in that province, and that's what was successful, and then the entire country adopted single-payer. We could do the same thing in the United States. People say, well, we tried it in Vermont and it didn't work. Well, it didn't work in Vermont because there were no waivers. I mean, how can you expect a state to have a single-payer system but not use any of the funding that they get from Medicare or Medicaid, and so still have the obligations under Medicare and Medicaid, not be able to use that funding, and also have to go to a single payer? It just doesn't work. What you need to do is give states the flexibility to use the Medicare and Medicaid funding if they can create a single payer system that covers everyone and that has better benefits than currently the federal government is providing. And that's what our bill does. It would allow states to get the resources to build successful single payer systems if they want. And we're going to be working closely with Javier Becerra, who I know, who's from California, to get the administration support for this bill. there's no reason why everyone shouldn't support a federalism approach to Medicare. Now, we need a state national policy, and that's our first commitment. But while we're working on getting national Medicare for all, let's at least empower the states to show us that this can be done successfully, where you have the activism to get single payer at a state level. So my plea to all of you will be to remain as passionate, as committed to this fight as you have been for many years. The public opinion polls show that the country is overwhelmingly with us. People want everyone to be covered. They understand that a single payer system, a Medicare for all system, is more efficient, is better, and they want the government to implement this. Our battle is really with the insurance companies. Our battle is with the special interests. Our battle is with the forces of the status quo. But I'm convinced if we continue to mobilize, if you continue to lead, if you continue to speak out, we will get a vote on the floor of the House of Representatives on Medicare for all, and we will get this bill past the finish line that will get the states the authority to have single payer systems. So thank you for all that you're doing, and I look forward to working with all of you in this fight for healthcare as a human right for every American.
Thank you so much, Representative Khanna, for your leadership and for continuing in Congress and in very, very challenging circumstances. So we are very grateful for you. There have been some questions about the bill numbers and so forth. So we will send questions to your staff if that would be helpful since you're on the phone. And I know you had a very busy evening. So thank you so much for taking these minutes out of your schedule. We really, really appreciate it. And we are
thank you.
Here.
Thank you, Melinda. And thank you to all the activists. You can't imagine how much what you're doing means to the country. You're fighting for the exact right cause in a national healthcare crisis. The focus should be on giving everyone healthcare, and your activism sustains those of us who are fighting in the building, unfortunately often in the minority, against the powers that be. Well, we know that people like you are fighting every day on the ground. That's what gives us the ability to continue to fight in the building.
Thank you so much. Next, I'm really happy to invite Amirah Sequeira, who's the lead legislative advocate and our very important partner, National Nurses United, to share with us a bit on the current plans and thinking for the reintroduction of the Medicare for All legislation in the House and Senate, and how our grassroots efforts can support moving that legislation.
Thanks, Melinda. Can you all hear me? Great. Hi, everyone. Good evening. It's great to be with you all here today. I think especially after the events in DC last week, it just feels really great to me to be in community with all of you tonight. So I'd like to first start by saying, we are at the beginning of a new congressional session, and this is, I think, an important moment for us in the Medicare for All movement, because what our country has been through in the past year, what our health system has been through, has been so devastating, right? Millions of Americans have lost someone they love to this virus, to COVID-19, and this pandemic has laid bare for everybody to see. Anybody who tried to say we didn't have problems in our healthcare system before no longer can say that, because COVID-19 has simply laid bare every single problem in our non-system of a healthcare system. And so I think we have a really important moment in the next few months to really start the next congressional session with an immense outpouring of support for the type of healthcare system, the only type of healthcare system that would have meant we could have addressed a pandemic like the COVID-19 pandemic more efficiently. That could have meant that, if we had Medicare for All a year and a half ago, we wouldn't be in the situation we are today. Hundreds of thousands of Americans would still be alive. Hundreds of nurses, hundreds of doctors would still be alive. So on that note, we are looking forward to a reintroduction of both of our Medicare for All bills, both in the House and the Senate, likely sometime in the month of February. The exact timing of the bill introduction right now is fluid. We're waiting to figure out an exact date. Now, that's partly because of everything that's happening right now in Congress, with impeachment trial likely to start in the Senate sometime in the coming weeks. But I think it is likely both bills will be reintroduced in February, which means we have somewhere between a couple weeks and a month to do everything we can at the grassroots level to ensure that our bills in the House and Senate are reintroduced with as much support as possible from other members of Congress. Last year, I'm going to first talk about the House bill. So last year, when we introduced the bill in the House, last session, 2 years ago, we introduced with 107 co-sponsors, and that was a really big deal. We ended the session with 118 co-sponsors in the House. Now, that's not including Congresswoman Jayapal in our count. Ideally, we want to introduce with the same number of original co-sponsors as what we left with in December, which is 118. At minimum, we need to introduce with at least 107, right? Because we want to show that we still have at minimum the same amount of support we had last session, if not more, right? Ideally, we want to show growing momentum on this bill in the legislature. And so the question is, how do we get to 118 co-sponsors in the House? So first of all, multiple members, unfortunately, multiple members who were co-sponsors in the last session are no longer with us in Congress in this new session. When you look at the number of returning Congress members who were co-sponsors last session, we're at about 106 co-sponsors, all right? Then when you look at the number of new members who are freshmen who committed to support Medicare for All in their campaigns, that takes us to about 114 co-sponsors. So assuming we are able to get everyone signed on as an original co-sponsor who sponsored the bill last year or who committed to co-sponsor the bill when they were running for office and they're currently a freshman, that gets us to 114. So just getting those folks is going to be work, right? For those of you who've done this before, many of you have, just because someone has said they're going to support it doesn't mean they're going to sign on, right? So we're going to have to do the work with every single one of our members to get them back on the bill or to get them to honor their campaign commitment. But that still leaves us at 114, about 4 short of where we want to be. So it's very important that across the country, we are pressuring our members of Congress, whether they have been Medicare for All supporters or not, to get on this bill. Certainly last year when we were what we call whipping the bill, trying to get folks on as original co-sponsors, there were some members that got on that we did not expect. So when it comes to the House side, we really have our work cut out for us. On the Senate side, we introduced the bill 2 years ago and we ended the session with 14 co-sponsors. 12 of those co-sponsors are coming back to the Senate, are back in the Senate, but we are losing 2. We're losing Kamala Harris, the next Vice President of the United States, and we're losing Tom Udall, Senator who retired. So their replacements, we don't know for sure if they're going to get on. So there's going to be some work to do to pressure Alex Padilla, who's coming in as the incoming senator from California. And there's going to be work to do on Ben Ray Lujan, who's the incoming senator from New Mexico. Now, a lot of us on this call did a lot of work to get Ben Ray on the bill in the House a year and a half ago. Part of how we got him on was that he was running for Senate, right? So we got him to make that campaign commitment. But I'm going to expect it's going to take some grassroots organizing to get him to actually sign on. And I'm just going to remind you all that each time we reintroduce in the Senate, a lot of the members who do eventually sign on as original co-sponsors each session, some of them take a lot of work each time. So we've got maybe 4 weeks, maybe less, maybe a little more, to get 118 co-sponsors on the House bill and 14 co-sponsors on the Senate bill. And it would be great if we got more, but that's what I want us to set as our goal. And to do that, we're going to need help from folks across the country, calling your members of Congress, calling your senators, scheduling meetings, getting involved with social media. And in the coming few weeks, Public Citizen, NNU, a bunch of the organizations that work together on Medicare for All, we will all be putting out calls to action, phone numbers so that you can easily make phone calls, social media guides, and we really hope you'll all help us get involved to make sure that when we reintroduce these bills, hopefully in February, that we are reintroducing them with as much support as possible. I'll just quickly end by saying that while we're looking forward to these reintroductions, and it's so important for us to focus on those, looking forward in the next 2 years, this next congressional session, in the past congressional session, we achieved incredible things in Congress together. We worked hard together at the grassroots level to convince 4 committees in Congress to hold the first ever hearings on Medicare for All, which was a huge achievement. So this is something we need to continue into the next Congress, is working to get more committees and important committees of jurisdiction to hold hearings on Medicare for All so we can start to advance this bill and continue this serious policy discussion at the legislative level. But I'd also note that we potentially have some other opportunities, especially with Democrats being in control of all 3 houses, to win potential other healthcare expansion legislation that might lead us down the way to Medicare for All. For example, in a COVID relief bill in a Biden administration, there may be an opportunity to win something like the Healthcare Emergency Guarantee Act. I know in many of the resolutions that folks are working on across the country, many of the resolutions call not only for the Medicare for All Act, but the Healthcare Emergency Guarantee Act to make sure that people can get the healthcare they need during COVID without having to pay. And so there might be an opportunity, we don't know for sure, but with our friend Senator Sanders as chairman of the Budget Committee, there might be an opportunity to figure out how to win that under a Biden administration. So just keep your eyes and ears peeled for that. And we're really looking forward to working together, especially in the next couple months, as we try to start this congressional session with as much support for Medicare for All as possible.
Thank you so much, Amirah. If you can take a look in the chat, there were some questions that came up for you. So if you want to answer them, that would be fantastic. And thanks for everyone's engagement on this. I think having heard from Representative Khanna and Amirah, I think it's clear that we have some real potential legislative opportunities that we didn't have with the Trump presidency and Republican-controlled Senate. But it's also continues to be crystal clear that the power of the insurance and pharmaceutical lobbies remains strong on both sides of the aisle. And thus we cannot let up on building the massive movement we'll need to overcome their money and political influence to eventually win Medicare for All. So we absolutely must push both Democrats and Republicans to respond to the growing humanitarian catastrophe, and we should call it that, of millions of people in this country who have lost their jobs and they've lost their health insurance in the middle of a pandemic. And those who have been suffering from gross racial disparities in our healthcare system since long before the pandemic began. We do this by organizing in our communities. The growing momentum of our local resolutions campaign we have seen over the course of recent months is really, especially in cities that have been ravaged by the pandemic, it's an opportunity to build on and expand the reach of our movement. We've seen cities like New Orleans, Knoxville, and elsewhere. Sorry, think we have, Paula, if you could put yourself on mute, that would be great. The growing momentum of our local resolutions campaign is really showing that. So we are, and I think what we've seen in some of the cities, New Orleans, Knoxville, and South Bend, as Amirah mentioned, use the local resolution process to call on Congress to immediately pass the Healthcare Emergency Guarantee Act to respond to the urgent crisis, as well as to say we need Medicare for all so that we never find ourselves in this horrific situation again. We've also seen local activists use the local resolution process to build bridges between the movements to pass a state single payer bill and the federal Medicare for all legislation to point to both state and federal legislation. So we urge you all to consider how you can use a local resolution effort in your community to respond to this moment in the best way possible. So I want to now turn it over to, we're really lucky to have with us Board Supervisor Holly Hatcher, who's a county board supervisor in Dane County, Wisconsin, the second largest county in Wisconsin, and it contains the capital of Wisconsin. We heard last month from Dr. Richard McGowan, who described the organizing that our Wisconsin Revolution had undertaken to push for this resolution. Well, they were very successful last week. The Dane County Board of Supervisors passed their resolution. So we're really thrilled to hear from Ms. Hatcher.
Good evening. Thank you for inviting me. It's a real honor to be here. I am fairly new to public office, but I'm incredibly proud that the first resolution I introduced as a supervisor for the Dane County Board was the resolution to support Medicare for all. I'm excited that it passed the board overwhelmingly last Thursday. This is a labor of love for me, personally and professionally. At my day job, I'm a nurse. I work full-time, and we're in the midst of a global pandemic. I see suffering and the negative impacts that inadequate or complete lack of health coverage have on our patients' health outcomes. I see patients having to decide between paying their rent and buying their prescriptions. I have family members that have suffered great hardship because of lack of health care. I see firsthand every day how the current system fails us miserably. It's just wrong. The time is now for local government to signal support for Medicare for all. To give you a little background and to speak to why Dane County chose to move the resolution. Dane County is a progressive community. And as Melinda mentioned, the capital city of Madison is in Dane County. Dane County has the youngest county board chair in the state of Wisconsin. Chair Eicher was supportive of me introducing this resolution. She is a strong leader. In 2020, we became the first Dane County board in board history to have a majority of women. The board is also historically young, with a significant number of Gen X and millennial members. Supervisor Wegleitner, one of our progressive activists on the board, was a mentor and a co-sponsor with me. I'm really fortunate to have such an amazing group of leaders to work with. Dane County is a leader in Wisconsin and champions progressive policies in our state. Our Wisconsin leaders, Senator Tammy Baldwin and Congressman Mark Pocan, are supporters of Medicare for all. We had incredible support for this resolution on the board, and of course, some opposition. A few questions signaling support for this as we were preparing for the inauguration of our new president, who supports a different healthcare option. A few felt that Medicare for all is not fiscally responsible and asked, how will we pay for it? The truth is, our for-profit, private, and employer-based healthcare system has proven to be expensive, inefficient, and has left millions of people without any healthcare coverage in the midst of a pandemic. The public option would allow companies to continue profiting off of the sick. The COVID-19 pandemic has laid bare any claim that our current system is either rational or sustainable. When discussing the resolution with my colleagues, I highlighted some of the ways that Medicare for all can positively impact county government. It would lessen the fiscal burden on local government. Local government often deals most directly with the consequences of our unaffordable, fragmented, and inequitable health insurance system. Rising healthcare costs have drained local government budgets of the resources they need to rebuild, renovate, and restore the vitality of our communities. It would end the burden on local employers to provide health insurance and would free up entrepreneurs to pursue business ideas without fear of risking the loss of their health insurance. People listen when you talk about saving money, And most people do believe that all Americans should have access to quality health care. So it's the right thing to do, the humane thing to do, and it saves us money. The Dane County Board overwhelmingly agreed. So how did local activist organizing lead to the success of the resolution? I was approached about sponsoring Medicare for All, the resolution, by Dr. Richard McGowan, as Melinda had mentioned. He is a tireless advocate and organized the activist effort in Dane County. I had initially met him at an event where our nurses were fighting to get our union back. He was there in support of the nurses. At the time, I mentioned to him that I was running for Dane County Board, an example of the connections we make through our activism. Local activists led to the success of the resolution in so many ways. By writing emails to county board supervisors, posting updates on social media, press releases, making calls to the board supervisors, and organizing public testimony for the committee meeting and at the board meeting prior to the vote. Public testimony was by far the most powerful tool we had. 18 people came to testify before the board. And I feel if some of the supervisors were on the fence prior to the meeting, I believe that the public testimony completely swayed them. We heard so many horrible, nightmarish stories. One activist shared that her mother was fired from her job after being diagnosed with ovarian cancer. She had worked for the company for 25 years. She then found herself sick, unemployed, and uninsured. She had to sell her house to pay for her medical care, and then she later died. We also heard some more cheerful testimony from an 11-year-old, Mari, who shared the persuasive speech she wrote for a 6th grade assignment supporting Medicare for All. Honestly, after the testimony, there was really no debate. So local activists absolutely led to the success of this resolution. And finally, the pandemic has demonstrated how our public health depends on the universal availability of high quality healthcare for all people. Our current system is just broken. Medicare for All is the best answer. We need it now more than ever. And if not now, when? Thank you.
Thank you so much, Board Supervisor Hatcher. You'll see in the chat a lot of accolades and support and thanks for your leadership and for Dane County, and we hope that it's again galvanizes people all over the country to do similar resolutions, which is, and this is very tied into what Amirah was talking about and getting support in Congress, because members of Congress, if they see the counties and the towns in their district officially supporting this, this is another tool that we can use to really show that support and to turn local officials like you into advocates that we can, that they will listen to in a different way than regular activists. So it's wonderful. Thank you so much for your leadership on that. And so now I would really like to turn it over to my colleague Brittany, who will share some more of our action steps on the resolutions campaign so that your community can follow the great footsteps of Dane County and introduce some of those local activist leaders who have been successfully organizing and building movements in their communities.
There. My name is Brittany, and I am the organizer for the Medicare for All campaign at Public Citizen. So I want to give you a brief overview of some of the next steps that we are taking in the resolution campaign at our end. If you've joined one of our webinars before, you've probably seen me pop up at some point to show you how to sign up for a local resolution effort near you. Let me show you again real quick. Bring out the share screen. There it is. Let me show again real quick how to do it. Where did it go? There it is. So this is our website, the Medicare for All Resolutions website. It's just Medicare 4, number 4, allresolutions.org. So if you go to the website and you click on, take action in your town and find your town. You can find out here by looking at the map. If a resolution effort is near you, you can scroll through the map. Or if you're just ready to just sign up and not pay attention, you can just click the link that comes up when you click on any of them. And you can sign up here. So let me stop that, bring that back. So that was just going over that again real quick. We do have, Melinda will put the link in the chat. We do have a new team of interns with us for this semester, Django and Rebecca. And they are working with us on outreach, both setting up one-to-ones with new signups who have signed up on that webpage, as well as reaching out to people in target areas where we know we have enough subscribers now on our list to get a local group going. We're coming up on 2 years of running this in April. So our list is getting really big. So if you've signed up with us in the past, or maybe you tried a resolution in the last year or so and would like to try again with some of the new people that have come in, please do get in touch with us. You can do this either by signing up again on the page I just showed you, or you can just reply to any of the email messages that Melinda or myself has sent you, like the auto replies you get after you sign up for the webinar. If you reply to that, it should go to one of us. We are at a very different place from this time last year. As I was saying just now, the volume of people signing up has increased, and we are matching that with a serious effort to turn that into extra support for existing groups, as well as brand new ones. So now I'd like to turn things over to a real powerhouse in organizing for resolutions in California, Walter Heath. Walter led a successful resolution effort in San Luis Obispo and has been making great progress in Santa Barbara. Walter? Walter, you're muted.
I knew that was going to happen. Thank you, Brittany. It's great to be with you all. I just want to tell you the local organizing group in San Luis Obispo started out by understanding the process of the city council. That's very important. And then identifying the gatekeepers at every step of that process. You can save yourself a lot of time. This, in many cases, is going to take months, but the process can be shortened if you understand what the process is of your city council and what they go through and who the gatekeepers of that process are. And then next, they made it clear to a friendly mayor, who's just a brilliant progressive mayor, a real rising star, that that group intended to work in partnership with her to obtain the support she needed among the members of council to get the resolution passed. And once that fell into place, it became much easier to do this. And so we're very pleased. Now, another local organizing group in Santa Barbara County, and actually in the city of Santa Barbara, in our congressional district, home of Adi Barkan, actually progressive activists and Medicare for All activists with the Center for Popular Democracy, with whom I worked to get our member of Congress on board, HR 1384. The local organizing group in Santa Barbara doesn't really understand their city council process as well as the local organizing group in San Luis Obispo. So it's taking some coaching, and with Brittany's help, we're doing the reconnaissance that we need to do to find out, how to get this through the chairs, so to speak, how to follow it every step of the way until it happens. Santa Barbara is a larger city than San Luis Obispo, roughly double population. It has 7 members on its council instead of 5. And so they break their work down into committees in a little finer level than San Luis Obispo does. They actually have an ordinance committee that looks at, resolutions that are sort of beyond the scope of what the city would normally, city council would normally deal with. And so we have to work with the members of that committee to get them to agree on the language and then send it on to the council and the mayor to vote. We have a friendly mayor in that situation, but it's going to take a little bit more time. And once we have those cities, the importance of your work of getting these city council resolutions is that then you can then go to your county boards of supervisors or whatever county governmental entity there is to get a resolution there. Once they know that most of the cities in the county support, then they will support it as well. Likewise, with respect to the congressional district, our member of Congress is on board and has already indicated that he will be a co-sponsor of the new bill that comes around. But we, again, are working as a partner with our member of Congress in getting these city council resolutions passed so that he can then say, there is support in my district for what it is that I'm doing. I'm just not freelancing this. That's very important because they run every 2 years. So the work that you're doing at a granular level is extremely important. I like to see that, the comments in the chat when we all get together about the forest, but folks, it's really about the trees. And it's going to take, many, many city council resolutions, many county boards of supervisor resolutions until we can achieve this, support at the state level. And you'll be surprised. All of a sudden, when you hit critical mass, it goes like grease lightning. So thanks for the time and good luck with your work. And please feel free to be in touch with me through Melinda or Brittany. I'll be happy to answer questions and help you any way I can.
Wonderful. I'd like to switch our focus all the way over to the East Coast to Nicole Cormendi. Nicole was part of another resolution that was recently passed in Fort Lee, New Jersey. Nicole, can you tell us more about your experience?
Yes, for sure. Thank you, Brittany. So yeah, we just recently got this Fort Lee Medicare for All resolution passed back in December. So I want to share a little bit about our process and what I think worked for us in Fort Lee. So when we were starting out our resolution efforts, we turned to a couple of resources that really helped us formulate our language of the resolution. We looked at the website that was shared earlier today, the Medicare for All resolutions website, and pulled from their sample resolution. We also looked at some successful resolutions in Philadelphia and in Essex County, and we took what we thought was relevant to Fort Lee and also added some more specific information about our town. So we looked at the number of uninsured people in Fort Lee, which if anyone else is interested in accessing that information, it's publicly available on the census website. So once we had our resolutions formatted, we wrote two, by the way. One was in support of the 2019 Medicare for All Acts, and one in support of the Healthcare Emergency Guarantee Act. So all of our co-activists signed on to that, some of whom were affiliated with progressive political groups locally, and we sent it into the council. And the way that we got it to the council was actually through a connection that one of our organizers had with the mayor's secretary, and we knew that the mayor and the council were generally supportive. So that was a good channel for us to kind of get it to them. And once the council had it, they discussed it in a closed session and approved it in an open session. So yeah, all in all, I think it was a pretty straightforward process getting the resolution passed, a lot more straightforward than I thought initially. But I think there were a couple of factors that worked to our advantage. So first, there was the historical context of Fort Lee, New Jersey being supportive of Medicare for All in the past. So back in 2011, when John Conyers' Medicare for All bill was on the table, Fort Lee actually approved a resolution in support of that bill. So, and we knew that because some of our co-organizers were actually involved in that push back in 2011. So when we sent in our resolution, we attached that older resolution and asked the council to reaffirm their commitment to Medicare for All. And also some of the council members from that time were still on the council currently. So yeah, I think that worked to our advantage. And we also did have these 5 residents signing on to the resolution. And that was an important point that we wanted to emphasize was that if you're trying to push for a resolution in your in a district or municipality, we thought it was important that the residents be the ones to sign on, because they do have leverage over, like they're ultimately going to be the ones to elect the council members in whatever upcoming election cycle exists. So yeah, so that was a little kind of summary of what we're doing. Moving forward, we're trying to reach out to other towns within our county to get our kind of larger county to support this. So we're looking through our networks to help other folks do this work too. So thank you so much for allowing me the time to share, and it's been so great to hear what other folks are doing to push for Medicare for all.
Wonderful. I'm so glad that you could share with us, Nicole, and join us. So next, I'd like to introduce Sophia Sepulveda of the Texas Organizing Project, who has been doing amazing work in organizing for health justice in San Antonio and across Texas. Sophia, what's the outlook for 2021?
Hi, Brittany, nice to see you, and thank you very much for allowing me the space to be here. The outlook seems pretty good, actually. We are getting ready to start kicking off the campaigns for the city council races in both Dallas and San Antonio. So with the members, we crafted questions in order to push them to support and champion the Medicare for All resolution in our counties. We also had a great success in Harris County, electing a former Right to Justice organizer with the Texas Organizing Project into the city council. So we have an end with our council member in Houston, Texas. We have now an organizing in Harris. We're ready to hire an organizing in Dallas County. And so we're super excited that we are pushing the Medicare for All resolutions during a pandemic, right? Like in San Antonio, we've seen so far over 1,600 people have passed away from COVID-19. We have around 200,000 people who have been infected with COVID-19. So this pandemic has increased and magnified the disparities of healthcare, especially when it comes to our communities. In San Antonio, we're 67% Latino, 3% Black, so 70% of our communities people of color. And 350,000 of them do not have access to healthcare. So it is super important that we were thinking about what other ways we have to do in order to protect those communities, especially during COVID-19. So we started pushing our county commissioners to increase funding into our public health system, which is our indigent healthcare program. We are pushing for Medicare expansion, and of course, Medicare for All. We have amazing supporters. We are actually just scheduling a couple of meetings with City Council. John Courage, who was one of our folks who we endorsed around 3 years ago, who got elected to City Council. We're having a meeting next Friday. The same with Harsha Jackson in Harris County. And we're super excited to continue the movement of healthcare, of Medicare for All. At the moment, we are super busy with organizing and in a virtual space, which is kind of strange to me, rather than going to community and having conversations one-on-one. We are getting ready to start doing leafleting rather than just having in-person conversations, so folks can be really safe, particularly because we organize in low-income Black and Brown communities, and we've seen how the pandemic is affecting our communities in greatest numbers. So we're super excited about the future of Texas in 2021. And with that, I thank you again for allowing me to be here, and take it back to you, Brittany.
Thank you so much, Sophia. It's always great to have you when you join us on our webinars. So my final introduction is for Gayatri Sanku of Metro DC DSA. Gayatri is part of a coalition of DC residents who have been organizing for a resolution in Washington, DC, and I think there are some exciting new developments. So take it away.
Yeah, hi, my name is Gayatri, and thanks again for having me on this awesome panel. So yeah, I wanted to speak a little bit today about the very exciting meeting that Melinda and myself and some other local coalition building partners had this morning with a DC Councilmember Nadeau. So we actually met with her to discuss the process of starting our M4A resolution in DC. And since DC is not a state, going through the council board is actually actually one of the most important parts of making sure that M4A is a strong priority item for the entire council member moving forwards. And really, what we wanted to make sure that she understood was that every city has unique healthcare disparities. And in DC, Black maternal mortality, mental health care, and chronic healthcare disparities are a huge problem for DC residents. And we wanted her to understand that by passing an M4A resolution, it's not just a statement or something that's going to go off into the ether and not mean anything. It's actually the first step in the process of admitting that we have these problems in our city, and that Medicare for All will actually be a very productive way of solving those issues for DC residents. And really what the most exciting part about it was at the end of the meeting, she was very enthusiastic about Medicare for All. She was very enthusiastic about the process of endorsing a resolution like this. And she was also helping us to set up the next steps for who else we could talk to on the council to actually make sure that this was getting passed. And I really felt that this was such a great meeting, and especially a great first meeting with the DC Council. As a city, we've been going through an immense like variety of suffering over the past few months, but especially the past week has been especially horrible. And to have a leader step forward and say that she's going to take a step towards something that progressives want in the city was really emboldening. And I really hope that moving forwards, this experience can be shared across the entire public citizen network. And through DSA, we're actually hoping to take this experience and tailor it to the entire DSA network of 368 chapters, 100 of which are actually on university campuses, and using that network of young people that are really mobilized for not just M4A, but also for working class causes to further this resolution building workshop. So it really was just an amazing meeting, and it wouldn't have happened without all of the support the public citizen gave us to set up for this process, and also in terms of how we're going to carry this out to really making it happen in DC. So thanks again, and really looking forward to continuing to work together.
Thank you so much. I can tell everyone is feeling as inspired as I am by all of these wonderful reports and updates from around the country. It's really, this is what it's all about. I mean, we've had a really, really tough week, tough year, and coming together in community and inspiring each other, I think is just a really powerful thing that we can be doing. So thank you so much. And I mean, this is where my hope comes from. So thank you. And our movement is really only growing. So I do encourage people to sign up on the map, as Brittany mentioned. Shoot us an email. You can write to medicareforall@citizen.org. If you haven't been in direct touch with us in a while, we can really help connect you, even if you've had some challenges in the past. I think we do have a much more momentum than we've had in the past, and it's very exciting. So before we close, I want to give Stephanie Nakajima from our close coalition partner of Healthcare Now an opportunity to give an announcement about their exciting upcoming Medicare for All strategy conference that will be coming up, that we all should be a part of, and to continue these conversations about how we approach the new political landscape in 2021.
Yeah, hi everybody. I'm Stephanie. Thank you, Melinda, by the way. Comms Director at Healthcare Now. This is a national grassroots single payer organization. And yeah, as Melinda said, I'm just here to give a shameless plug for our Medicare for All strategy conference. If you're already registered, just give a little shout in the chat. I'd love to see your name and where you're from and who we're going to be seeing this weekend, or rather next weekend. So the most important thing to know about the conference is that registration ends tomorrow. So I'm going to put the link in there. So I'm glad that this call took place like right before the registration closed, so I could just get it in for y'all right before. So the conference, Healthcare Now hosts this jointly with the Labor Campaign for Single Payer. We usually do it in person. This is our very first time doing it online. And we're expecting about 1,000 attendees from both community groups and labor groups. So it's probably going to be the largest, Medicare for All event ever. And we're trying to do this online conference a little differently from what we've, I think that a lot of groups have been doing conferences for the very first time, doing them online and not really knowing what to expect. And since we're like a year into the pandemic now, we've sort of learned a little bit about what works and what doesn't. Zoom is a uniquely exhausting platform. And so we decided we're not going to squish a whole like 3 days of content into an all day, Saturday, Sunday Zoom marathon. What we're going to do instead is all the plenaries are going to be pre-recorded sessions that we're releasing like 1 hour at a time starting Monday night. So every day has a theme. And then we're gonna like be reserving Saturday and Sunday for like more interactive stuff, workshops, caucus building and informal networking. Let me see if I can share the screen. Okay, so just to give you an idea of like what the conference looks like, and I can actually put this link in the chat as well. So we're kicking off Monday with Martin Luther King Day, the future of racial justice and Medicare for all. Dr. Abdul El Sayed has given the keynote for that, and we're also going to have Martiz Chisholm, Dr. Victoria Dooley, and Dean Robinson from UMass and Labor Notes talk there. The next day is COVID crisis and the case for Medicare for all. We're gonna have a keynote from a president at NNU there. Wednesday, we're doing Medicare for all and the future of labor, which Crystal Ball is moderating. Actually, it was so cool to see this one being recorded because it's for women. I've never seen a labor panel that was all women before, but so that might be a first. And then the Biden agenda, so talking about like what we expect. On Thursday, we're gonna be talking about what we're gonna expect to see in the coming year with what Biden's gonna push for healthcare. Spoiler, we're not gonna like it if it's even anything at all, and how we wanna sort of respond to that. And then Friday is New Year, New Congress. And we're gonna have Amirah actually speak on that night, as well as some of our legislative leaders. And then Saturday, you can just get a sense, and again, I'll just drop this in the chat, but Saturday and Sunday is gonna be all workshops, and Melinda, I believe, and Brittany maybe are doing a workshop on resolutions, and CPD is doing a lobbying workshop. We're doing a workshop on online organizing. We're doing like a ballot initiative workshop. So that will just give me unshare the screen. Fortunately, I won't be doing the tech stuff for this online conference. I'm actually not really sure how to unshare my screen. New share? No. Stop share? Okay, thank you. All right, somebody did it for me. Anyway, so yeah, so that's the conference. Oh, I see some questions. I'll answer those in a minute, but yeah, please register. We expect like record high attendance, and we're gonna be so excited to actually be able to talk and see a little bit of you on Saturday and Sunday.
Thank you so much, Stephanie. And as she mentioned, we're excited. We'll be having a municipal resolutions workshop, and the South Bend council member from the council member from South Bend, Indiana will be joining us, as well as other activists from New Jersey. So we're really excited to be doing that, and it's a really important conference. So, we are at the hour. So I really want to thank everyone who participated in tonight's discussion. Of course, a special thanks to Congressman Khanna and all of our amazing speakers on tonight's call for taking the time out of your busy schedules to share your insights. We are excited about this momentum. We obviously have huge challenges ahead of us, but I feel more inspired than ever, as I mentioned, hearing about this work. We encourage you all to sign up we want to have one-on-one conversations with you if we haven't in a while. We have more capacity to be able to do that. We want to be able to connect people across movements and to use this opportunity to really to build the movement that we need to eventually win. So please be in touch with us about how we can support you in your organizing. You can mark your calendar calendars for our next webinar at the same time on Wednesday, February 17th at this point. So please send me a note. Let us know if you have upcoming ideas or if you want to give a report from your community, and if you have ideas. So thank you. And please be safe these coming days. It's not just in Washington, D.C., but all over the country. We need to be vigilant, and we need to work hard to defend our democracy and to work for healthcare justice. So thank you so much.
Thank you.